Hi, everybody. My name is Mika Riley. I'm a doctor of physical therapy at MoveMend in Seattle, Washington, and I'm here tonight to discuss and educate you about ankle and foot injuries in athletes, specifically related to soccer, how to prevent them, and answer any questions that you might have regarding reducing your injury risk. So I want to go a little bit over about who I am. I graduated with a bachelor's in exercise science from Eastern Oregon University and obtained my doctorate of physical therapy from the University of Washington, and then followed with an orthopedic residency and specialization from the University of Washington as well. So I want to go over a disclosure first. So the information provided to you today is really intended for educational purposes only and should not be substituted for medical advice from a doctor or healthcare professional. So what we're going to go over, four main things, four objectives here. Really want you to be able to identify and understand some common and ankle foot injuries with regard to soccer players, assess your athletes' risk for ankle and foot injuries, understand the importance of how us PTs can be of resource to you during this time, during an injury, and gain insight into any prevention and injury risk reduction programs. So to get us started, we're going to go over ankle sprains. Ankle sprains really are one of the most common foot, ankle, sports-related injury for which many people seek medical care for. People of all ages sprain their ankles, and it's said that 4 in every 10 first-time ankle sprains actually occur while playing sports. So there are quite a few of ligaments in the ankle. And the most commonly sprained ankle ligaments in soccer specifically involve the CFL and the ATFL. So which you can see on the screen here where my cursor is. The CFL is right here on the outside of the ankle. And then the ATFL has two fibers, one that's directly in front of the ankle and then one that stems over here on the side as well. So these ligaments typically are sprained during a lateral ankle sprain, is what we call it. And those typically occur when your foot goes inward and you twist your ankle inward. Symptoms we typically have people report, they report swelling, pain, and usually difficulty walking or painful when they're walking. So athletes who are susceptible to ankle sprains or who have had many ankle sprains, we would classify them under the category of what we call chronic ankle instability. And this is typically diagnosed when a person continues to have problems with tasks like walking or even playing their sport for more than a year after their initial injury. And people with chronic ankle instability will typically say, I roll my ankles all the time. It doesn't take very much. It feels unstable and feels like it's giving way. So now we're going to talk a little bit about ankle sprain rehab and what that looks like a little bit. So our priorities really are to decrease swelling in rehab and improve range of motion and joint mobility and provide really an optimal healing environment in the acute phase, which usually is about less than 3 weeks after the injuries happened. And our ultimate goal really is to optimize healing, reduce recurrent ankle sprains by addressing control and strength deficits that we may see. And the end goal really is to return to full participation in their activity or their sport. And this timeline might look like it might take as little as 1 day for them to recover. It might be a very mild ankle sprain, or it can take as long as a few weeks or even a few months after the ankle sprains happened. So full recovery with no symptoms or limitations may take sometimes months or even years, especially if they've had multiple ankle sprains occur one after the other. So now we're going to get into Sever's disease, or it's also called, the medical term is calcaneal apophysitis. It is a mouthful. So in diagnosing and treating young athletes, this is who we typically see this in, who present with this pain. We really need to consider their skeletal immaturity and the fact that they're still growing, and that they have open growth plates around the areas that have frequent stress. One area in particular is at the heel, and it's known as Sever's disease, or as we've called it, calcaneal apophysitis. Um, this injury occurs where the tendon inserts into the bone, as you can see here in the bottom left picture. Here's the Achilles tendon, and it's this area where it comes and meets that heel bone. And then as you can see, there is just shy of it, in front of it is a nice growth plate. So repetitive stress can really lead the tendon to pull at this region, um, the area where the tendon meets that bone, and creates irritation around that area and even the growth plate. So Sever's disease typically is seen in children aged 7 to 9 years old. So athletes in the growing phase is where we typically see it, and commonly we see it in males. However, now that times are changing and we're seeing more females being more involved in athletics as well at a younger age, we're starting to see them as well be diagnosed with it. In Sever's disease, repetitive loading through the heel with increased weight bearing activities leads to the increased pulling on the Achilles tendon at the heel. And young athletes will typically complain of pain at or around the heel, and sometimes even along the outside of their Achilles tendon. This pain is typically increased when they're performing their sport, doing the specific activity. Some athletes might even, depending on how severe the irritation is, some might even just complain of it hurting while standing or simply even walking. But most definitely, we typically see complaints of quite a bit of pain when they are running and jumping. So what we do for Sever's disease in rehab, some athletes might have to be advised to stop playing their sport for a couple of weeks due to the pain and to allow the irritation to calm down. We typically prioritize range of motion. We look at their joint mobility at the ankle and assess their strength through a progressive loading program, and really aim to improve their movement efficiency. A common treatment for Sever's disease is to use a heel cup or some sort of foot orthotic. And orthotics or gel heel lifts or heel cups um, help with placing the foot in more plantar flexion, which is this position here, pointing it down a little bit to help decrease the pull on the Achilles tendon that eventually pulls on the heel. So any movement of the foot going up towards your nose will really irritate that tendon bone area for them, and it won't really feel very good for the athlete. The other option is taping. It's another method of treatment. It really decreases the strain on the Achilles tendon and reduces pain at the earlier stages of the irritation, and even when potentially transitioning back to their activity. Symptoms of Sever's disease after initiating a PT program typically go away within a few weeks to a couple of months, maybe 2 months. It all really depends on how irritable that area is and how soon after it started bothering them that they came in to see a rehab professional. All right, now we are going to talk about fractures. So stress fractures occur because of overuse and repetitive activity in running sports, specifically like soccer. A stress fracture is a small break or a crack in a bone, or sometimes even bruising within the bone. Stress fractures often occur at the second or third metatarsals or at the base of the second and third toe, as you can see right on this picture here. It'd be right about here. So the repeat stress of walking and running ultimately leads to wearing down of the bone. So bones naturally have a protective mechanism where new bone grows and replaces older bone. Now, with vigorous and high intensity activity that sports can include, it can cause the bone to break down at a faster rate and outpaces the body's natural ability to repair and ultimately cause a stress fracture over time. So traumatic fractures are also frequently they also frequently occur at the ankle bones, namely the tibia and the fibula, or excuse me, the tibia and the fibula, and that's your shin bone during high impact sports. However, we also see quite often some fractures in the foot, specifically at those second and third metatarsals. Those are quite common. They are caused typically by a direct blow or impact to the foot, either from being stepped on, being kicked, or even kicking the ground, or even spraining the ankle. Other fractures that we often see as well and are associated with soccer are avulsion fractures and Jones fractures. An avulsion fracture occurs when a small piece of bone is pulled off a larger bone by one of the tendons or ligaments in the foot. So, typical symptoms that an athlete will complain about during a traumatic fracture is they heard it break. They had pinpoint pain that occurred a couple hours after the incident happened. Maybe they might have swelling and bruising and discoloration in that area, and they most definitely will have a hard time walking due to pain. So Jones fractures now, they happen at on the outside of the foot, more towards the fifth toe. And typically this area is known to have less blood supply. So this area really is susceptible to delays in healing and is more difficult to treat than an avulsion fracture because of the low blood supply in this area. So symptoms that we typically are seeing when we suspect a Jones fracture is pain that decreases with rest, pain that occurs or happens when they're performing their activity or their sport, swelling and bruising on the outside of the foot, and maybe even some tenderness, point tenderness to that area. So people ask, well, is there a specific cause leading up to the fracture? And the answer is maybe, maybe not. And there could be many causes, and some causes can be because of bone insufficiency, because they lack vitamin D, maybe poor athletic conditioning or improper technique during their sport, which is very common. Those two are very common that we see as a reason. Changes in surface where they transitioned from a flat turf to a grassy area, and maybe even improper footwear like flimsy or no support. Sometimes we see this with very flimsy cleats like mercurials or something like that. But athletes experiencing pain should stop playing their sport and seek medical advice immediately to rule out a fracture. Stress fractures typically take a few weeks to show up on an x ray image because they are so small. The doctor might eventually recommend a bone scan or an MRI if they suspect a stress fracture. And then eventually, after rehab and going through, they'll have some follow-up appointments with x-rays to show that there's good bone formation where the fracture is. So now we're going to talk about the rehab after fractures. So after being diagnosed with a fracture, the question is, well, how long is this going to take to heal? Typically, it takes about 6 to 8 weeks to heal. And this time frame really depends on the age of the person that's experienced the fracture and how long they've been dealing with it. So it could potentially take 6 weeks, or it could take longer than 8 weeks. Some athletes will be put in a boot to allow for healing to occur. And this is just because an athlete is placed in a boot does not mean that they need to really rest entirely. During PT, this really is a great time to initiate a strengthening program and address any ankle foot mobility issues and restrictions that happen because somebody's in a boot. And so that way, once the boot is off, we won't be starting from ground zero. We actually are trying to mitigate the effects that happen when wearing a boot. So now we're going to talk about, there are quite a bit of things that we can change to prevent some of these from happening and to improve our performance. And things like this are strength and conditioning to reduce that injury risk. There are also other protective factors for soccer injuries as well. Like there are warm up programs in reducing all soccer related injuries across genders, ages, and all skill levels. Specifically, the 11 plus warm up. It's formerly called the FIFA 11 or the FIFA 11 plus warm up that helps reduce ankle and foot injuries by 39 to 44%. To see these effects, it typically needs to be used in training 2 times a week to show at least 40% reduction in injury at the ankle and the foot. Now, this has many advantages as well because it not only reduces ankle foot injuries, but it also has great reduction in knee injuries as well. So there's this really awesome app called the Get Set app by the International Olympic Committee. It's really an innovative and accessible app that provides free access to videos regarding whatever sport you may be in and body specific warm up programs. And the 11 plus is also on there under the soccer tile and includes all videos to see how you need to perform that. Now, prevention programs should not be the only thing that's used alone. We know that weak athletes get hurt more often. We don't really need statistics to tell us that. What we need and what needs to happen is to start building the foundation of athletes and making sure that that foundation is as strong as it can be to help reduce the risk for injury. And this means that starting with the basics of proper core, hip, knee, foot strength for your specific sport, namely soccer, when it comes to preparing for the sport. And this is really this is where prioritizing a progressive loading or a strength and conditioning program will benefit an athlete because these programs have proved to reduce risk of injury by almost more than 50%. Unfortunately, what we're seeing is seeing a lot more field time and less off the field programs like sport specific strength and conditioning programs. And ultimately that mind shift, we need that shift to occur. So because we can't keep a player on the field if you aren't prioritizing their health and their strength, rather than we would rather see them on the field instead of being sidelined because of a potential preventative injury that happened. So that's it for the educational webinar, very short and sweet. But I hope this was very helpful to many of you. If any of you have any questions or might have an athlete who has experienced or is currently experiencing any of these injuries that we've talked about today, feel free to connect with us with any questions you might have, or even book a free 30-minute screen to have us take a closer look at it.